Hello students, so today we are going to deal with yet another topic, that is difference between adult and child. Okay, so we should know the difference between adult and a child, right? Who is called as an adult and who is called as a child? So we can say adult is those person who are highly mature. They have achieved their immunity. They have achieved the various reflexes as an adult. Whereas a child who has just come out of the womb, they're just viewing the environment. For them, everything is a new. And where their immune system is developing, where their organs are developing, where their growth and development is there, they are achieving certain miles according to their age. So, and those children we used to refer to as child. So, we can say, so these are the things that we are going to deal with this in this unit, and we should be aware about the differences between the adult and a child so that we can give a proper treatment to this age group according to their needs, according to their size, according to their variations. So for that we should know, or we should clarify the doubts regarding the adults as well as the childs. So let's begin with our introduction about the child and the adult. The child and adult are two terms that are used to identify two stages of human being in the society, and thus the primary difference between the two words. So we can say this child and adult, they are basically the two terms, right? They are two terms, and which are basically we are using in two different stages. Child is different and adult is different. We cannot compare a child and an adult. Why? Because they are being there in two different stages, right, of human being, that is in the society, and thus the primary difference between the two words are related to the demarcations of the two stages. So we can say these two words, they are being related to the two different stages of the human beings. So that is why we should be aware about the term the child and the adult. A child is a young human being probably under the age of 18. So we can say, or we can define it as child. Who is the child? Child is basically a young human being which is under the age of 18 years. An adult, on the other hand, is a fully grown human being. So we can say, how can we define adult? Adult, who is a fully grown and individual, who is highly mature, right? He is a complete man. In the society, the adult have much more responsibility towards other and themselves as well. So basically what is happening in a society, we can say there are more, and we can say responsibility on the shoulders of that person. Why? Because he has having certain responsibility towards himself also, and at the meantime he is having responsibility towards the other also. This is mainly because of their independent status. Now why it is being there? Why? Because they are living independently. Their life of living is different, their status of living is different. So that is why they are having the independent status, and that is why they are having the more responsibility as compared to a child. Now, our next question that always raises in our head is, who is the child, right? So child is a young human being. According to United Nations definition, a child is a human being under the age of 18. So we can say, what is a child? Child is basically a young human being. A young human being who has just came out from his mother's womb, who is unknown about each and everything. What is environment? What is cold? What is hot? Who is his mother? Who is his father? The child is unaware about it, right? So according to United Nations definition, a child is a human being who is under the age of 18 years. However, biologically speaking, an individual can be considered as a child only until puberty. So we can say, if biologically speaking, that is if we speak in the language of science, it says An individual can be considered a child only until puberty. If a child attains puberty, till that time, we can consider the child as a child until puberty. Nevertheless, in most countries, a person who is under the age of 18 is considered a child. Whereas we can say in certain countries, a person who is under the age of 18 years, they are being considered as a child. In every society, children are given prominence because it is these children who become the citizen of the society one day. Yes, and at most every states they are giving prominence to children. Why? Because these are those children who are going to become our next generation or next future of our country. So we can say child, they're basically a young human being, and the United Nations, they define child as those human beings who are under the age of 18 years. And however, if we speak in the language of the science, an individual can be considered as a child until puberty. Nevertheless, in most countries, a person who is under the age of 18 years, they are considered as a child. In every society, the children are prominence. Why? Because these children are going to become the future citizen of our day, of our country. Next is a child usually lives with his parents and relatives in foster care or similar setting. It is, we can say, basically a child for his safety. He'll live with his family. He'll live with his relative, right? And whereas in foster care, if he is living, he is also living in that environment only. It is a societal belief that a child is unable to take important decisions alone as he lacks general awareness of the society and has less experience. Yes, it is basically a society views. We can say if a child is small, right? We always used to say if a child is sick, it is the basically it is the considerations of a parents, which hospital to take, what treatment to be given, if they are having the financial aid in their hand, right? So it is all the decisions being taken by the individual parents. Now, these are not the belief. Who has developed this belief? These belief has been developed by the society itself. So we can say a societal belief that a child is unable to take the important decision. Why? Because he lacks certain general awareness of the society and the child is not having the experience. Children should not be treated as the same as adults and should be loved and cared for. And one thing every parent should consider is that children are different and adults are different. Children cannot be compared with the adult. And the children, they are in required and more of love and caring, right? If we compare a children as an adult, then their way of living, their way of looking their parents will be different and they will not be listening to you. Why? Because they feel that they are being treated as an adult only. Why? They are caring for me. So at the end, we can say the children should be look like a children only, as in a way they are behaving it. They should be cared as well as they should be loved. According to psychologists, childhood is an important stage in the overall development of an individual, not only physically, but also mentally, socially, and also emotionally. So we can say, psychologists, they basically says, childhood is an important stage in the overall development of individual, right? We can say yes, obviously, because if a child doesn't enjoy his stage, then who will enjoy that stage? So we can say childhood is basically an important stage, the overall development of an individual. It's not only physically, but also mentally, socially, and emotionally. Okay, so a child should enjoy physically also, child should enjoy mentally also, socially also, and emotionally also. Let us see, the child should feel obliged, the child should feel happy, the child should feel safe that he is living with his mother and father who is looking or who is caring for the child very nicely. The development of a child occurs through the formal and informal education that he receives both within the premises of school and also at the home and his surrounding environment. So we can say the basic development of a child, it basically occurs inside the premises of the school also, at the meantime outside also. So we can say how inside premises in the form of parents, where parents are giving certain educations to the children, where they're guiding their children, where they are saying what is good and what is right for them. Outside the premises in the form of a school, where the teachers are giving educations, where they are learning new things, where they are learning to behave, everything they are learning it. That is, we call it as they are getting the formal and informal education. At the meantime, they are also getting educations from their friends also, right? Small, every age groups, children's, they behave differently. The way the children perceive the things, that is all the education that is being get by the students also. So we can say the development of the child occurs through the formal and informal education that he receives both within the premises of the school and also at the home and his surrounding environment. So we can see in this diagram, this is a diagram of a child. We can see it's having a larger head. This we call it as the child is having a thinner cranium, higher respiration rate and a flatter rib, smaller airways, lower blood volume, thinner skin, less fat and muscles, higher metabolic rate, more flexible bones and lower immunity. So these we can see, these are the picture of a child, where the child is having a thinner cranium, where child is having a high respiration rate, where the child is having a flatter rib, larger head, smaller airways, lower blood volume, thinner skin, less fat and muscles, more flexible bones and lower immunity. They are having the low immunity. So these all are the features of a child. You can see in this diagram how a children laugh. You can see in this picture how a children laugh. So we can see how a children smile. To see the eyes of the child is blinking like anything, blushing his face. He is just holding two of its hand to clap. He is just using all the features and he is describing himself in this picture. This is the peculiarity of this picture. What this picture is saying, child is different and adult is different. Next, we will be, this all we have learnt about the introduction about the child and the adult. Now, let's begin the differences between the child and adult. We should classify it according to the various system wise. So, first is anatomic and physiologic difference. We are going to learn one by one these various things, anatomic and physiologic difference, integumentary systems, respiratory systems, adult and fetal circulations, hematologic systems, urinary systems, then gastrointestinal systems, endocrine systems, reproductive system, musculoskeletal system, neurologic system, lymphoid and immune system, psychological changes and cognitive development. So these are the classifications that we are going to see between an adult and a children. So let's begin with our first classification, that is anatomic and physiologic differences. So I have divided it into two types, that is children and adult. So we can see in anatomic and physiologic difference, the first is newborn head is larger and heavier as compared to his body. We can say newborn head is larger and heavier as compared to his body. His body comparison, if we see the head, it is being larger, it is being heavier. Adult head is not heavier than body. And what does the adult says? Adult head is not heavier than the body. Adult head is not heavier than the body. Second is thinner skin. Children have thinner skin than adult. Second difference is thinner skin. Thinner skin, we can say children, they basically have the thinner skins, adults don't have. So adult skin not as much thinner than the children. So we can say adult skin are not thinner like children. Third difference is rapidly dividing cells. So we have third difference is rapidly dividing cells. Children cells divide more rapidly than adults. So we can say children's cells divide more rapidly than adults. That is, more rapidly the cells are dividing in children than adult. In adult, it takes a normal cell divisions. It takes in a normal way. That is, we call it as normal cell division. Fourth point is no tears in early infancy. This is a very important point. That is, no tear is being present in early infancy. Whereas in adult, there is tear formation in the eyes. We can see there is tear formations in the adult. We can see, but there is no tear formations in the infancy, early infancy. So we can see the difference between two. First is newborn head is heavier and larger as compared to his body, whereas in adult head is not heavier than his body. Second, we have seen is thinner skin, in which we have said that children, they basically have the thinner skin than adult, whereas adults, they don't have the thinner skins. We can say their skin is not thin as compared to the children. Next is rapidly dividing cells, in which we have learned children's cells, they divide more rapidly than adults, whereas in adult, normal cell divisions happen. Fourth point we have learned is there is no tear formations in early infancy, whereas in adult, we can see there is tear formations in the adult. So this was all about the anatomic and physiologic difference. Next is we can see the systemic difference also. According to that, we have divided it: lymphoid and immune system, integumentary system, respiratory system, heart and circulatory, hematologic, urinary, gastrointestinal, endocrine, reproductive, muscular, neurologic. These all we are going to learn step by step. So you can see in this diagram, there is immature blood-brain barrier, there is larger body surfaces, there is rapidly dividing cells. Then they are having the thinner skins, they are having the higher respiratory rate. So what we have learned in the previous slides, it's all the summarizations of all that thing. Immature blood and brain barrier, there is larger body surface area, rapidly dividing cells, they are having the thinner skins, and they are having the high respiratory rate. Next is integumentary system. So in integumentary systems, there also appear certain differentiations. So first is the apocrine sweat gland, small and non-functional from the birth to preschool years. So we can say in children, the apocrine sweat gland, that is one type of a sweat gland that is being there in children's, they are small and they are non-functional from birth to preschool years. That is, from birth to preschool years, that apocrine sweat glands is non-functional. Whereas in adult, apocrine glands are properly developed in axilla, areola and genital area. So we can say apocrine glands, they are basically developed properly in axilla, in areola as well as in the genital area. Second point is skin problems. Now the children suffer from certain skin problems like linear disease, scleroma neonatum, tinea capitis, tinea pedis, right? Whereas these type of the skin problems, they are not seen in the adults. Okay, so these problems, they are not seen in the adults. So we can say first point that we used to see in integumentary is first apocrine sweat glands, they are small and non-functional, that is from birth to preschool years. And in adults, apocrine sweat glands, they are properly developed in the axilla, in the areola, in the genital area. Second is the skin problems. The skin problems, they are having certain skin problems like linear disease, scleroma neonatum, tinea capitis, tinea pedis. Whereas these type of skin problems, they are not seen in the adults. You can see in this picture also, in this image also, these are the certain skin problems that usually happens in our children's. Okay. Next comes the respiratory system. So next we are going to deal with the respiratory systems. So the difference between the children and adult in respiratory system is respiratory rate 30 to 60 breath per minute. So we can say the respiratory rate in children is just 30 to 60 breath per minute, whereas in adult it is 16 to 20 breath per minute. So in adult it is basically 16 to 20 breath per minute. Heart rate is 100 to 160 breath per minute. Heart rate is 100 to 160 breath per minute, whereas in adult it is 60 to 80 beats per minute. So we can say heart rate in children is 100 to 160, this is beats per minute, whereas in adult they are 60 to 80 beats per minute. So you can just see the difference between the children and adult respiratory rate. Respiratory rate in children is 30 to 60 breath per minute, whereas in adult it is 16 to 20 breath per minute. Heart rate is 100 to 160 beats per minute, whereas in adult is 60 to 80 beats per minute. Second is tissue of respiratory tract are delicate and do not produce sufficient mucus. So we can say the tissue present in the respiratory tract, they are very delicate and they do not produce mucus, whereas in adult it produces sufficient amount of mucus. Third is no protection from invasion of microorganism. There is no protections from invasion of microorganism. We can say why? Because their immune systems is being developing. It's not developed. They are having a low immune systems. So because of that, there is no protections for the invasion of microorganism. Whereas in adult, they have the protections from the invasions of infectious microorganism. So we can say in adults, they are having the protections from the invasions of the infectious microorganisms. So we can see the difference between the children and adult. First is the respiratory rate in children is 30 to 60 breath per minute, whereas in adult it is 16 to 20 breath per minute. Heart rate in children is 100 to 160 beats per minute, whereas in adult it is 60 to 80 beats per minute. The second point is the tissue of respiratory tract, they are very delicate and they do not produce sufficient mucus, whereas in adult they produce enough of mucus. Third is there is no protection from invasion of microorganism, whereas in adults there is protections from invasions of infectious microorganisms. Next comes the adult and fetal circulation. So first, we have learnt about the anatomical and physiological differences. Second, we learnt about the integumentary systems. Third, we learnt about the respiratory. Now, we have going to deal with adult and fetal circulation. So, let's see the difference. I have divided it into criteria wise. So, the characteristics are basically adult have the adult circulations, and children they have the fetal circulation. So we can say adult have the adult circulations and children they have the fetal circulation. Artery, we can say in adult they carries oxygenated blood away from the heart. We can say in adult they basically carries the oxygenated blood away from the heart, whereas in children they carries oxygenated blood back to the heart. So we can say adult they carries the oxygenated blood away from the heart, whereas in children they carries the oxygenated blood back to the heart. In heart they provided the blood back to the heart. Third is veins. Veins, they carries non-oxygenated blood towards the heart, that is they carries non-oxygenated blood, okay, whereas artery carries oxygenated blood and veins carries non-oxygenated blood towards the heart, whereas in children it carries oxygenated blood back to the heart. Okay, so these are we can say the difference between adult and children. Fourth is exchange of gases. Exchange of gases usually takes place in the lungs, and in children the exchange of gases usually takes place in the placenta. So we can say the characteristics, it is basically adult circulation, it is basically fetal circulation. Arteries, it carries the oxygenated blood away from the heart, and children's it carries the oxygenated blood back to the heart. Veins, it carries the non-oxygenated blood towards the heart, whereas children it carries the oxygenated blood back to the heart. Fourth, exchange of gases. Exchange of gases, we can say it basically takes place in the lungs in adult, and in children it basically takes place in the placenta. So basically we can see the difference between characteristics. The exchange of gases in adults is basically takes place in the lungs, whereas in children it takes place in the placenta. Next, fifth point is pressure. So according to this pressure criteria, they have increased pressure on the left side of the heart. In adult, they are having the increased pressure basically on the left side of the heart, whereas in children, increased pressure on the right side of the heart. So there is increased pressure on the right side of the heart. So this was all the difference between the adult and fetal circulation. So characteristics, we can say in adult it is basically adult circulation. In children we used to say fetal circulation. Arteries, it basically carries oxygenated blood away from the heart, whereas in children it carries oxygenated blood back to the heart. In veins, it carries the non-oxygenated blood towards the heart, carries the oxygenated blood back to the heart. Fourth, exchange of gases, it basically takes place in the lung in adult. It basically takes place in the placenta in children. Fifth is pressure. There is increased pressure on the left side of the heart, and there is increased pressure on the right side of the heart. So you can see this is a fetal circulations. This is a placenta we can see, right, and this is an umbilical vein. This is, we call it as venous duct, umbilical artery, oval opening, arterial duct. So these are the fetal circulation. Next comes the hematologic system. Okay, so in hematologic systems there is also certain differences. In children, newborn RBC are microcytic. So we can say in children, the newborn RBCs, they are basically microcytic, whereas in adult RBC are macrocytic. So we can say newborn RBC are micro and adult RBCs are macrocytic. Microcytic, that is equal to MCV less than 80. We can say microcytic, that is MCV less than 80, and macrocytic in which MCV greater than 100. Okay, so we can say in children the newborn RBCs are microcytic, in which the microcytic is MCV less than 80. Adult RBC are macrocytic, in which microcytic MCV is greater than 100. Lifespan of RBC is 60 to 90 days. So we can say the lifespan of RBC is only 60 to 90 days in children, whereas in adult the lifespan of RBC is 100 to 120 days. We can say the lifespan of RBC is 100 to 120 days. Blood volume, neonates have 85 ml per kg of their body weight. So we can say blood volume, the neonates are having 85 ml per kg of body weight, whereas in adult they are having 62 ml per kg of their body weight. So we can have the hematologic difference as newborns RBC are microcytic, that is MCV less than 80, whereas adult RBC are macrocytic, in which the macrocytic is greater than 100. The lifespan of RBC in children is 60 to 90 days, whereas the lifespan of RBC is 100 to 120 days in adult, whereas blood volume in neonates is 85 ml per kg of bone weight, whereas in adult it is 60 to 70 ml per kg of the body weight in adult. Next come the urinary system. So in urinary systems, how is the difference between children and adult comes? First is infant kidney are immature with reduced ability to filtrate and concentrate the urine. So we can say first is basically the infant kidney. Okay, the infant kidney, they are immature, they are not mature. Why they are not mature? Because they are small in size, they are being developing. The kidneys are like a bean shape, they are very immature, and they are having the reduced ability to filtrate. Okay, the filtration process will be less, with concentrated urine will be there. Okay, whereas in adults the kidneys are mature enough to function, whereas in adult the kidneys, they are mature enough, they are highly mature enough to function. Second is nephron are not grown and functioning. Second is the nephron that is present in the urinary system, right? The nephrons, they are not yet grown and they are not yet functioning, whereas in adults the nephrons are functioning properly. Third is not under voluntary control. the children, they are having no voluntary control, right? Because they are learning, they are in a learning stage, they are learning to urinate, they are learning to control everything. So, not under voluntary control, whereas adult, they have achieved that process that we call it as they are under voluntary control. So, we can say infant kidneys, they are basically immature with reduced ability to filtrate and concentrate the urine, and in adults kidneys, they are mature enough and they are functioning properly. Second is nephrons are not grown and functioning in children, whereas in adults nephrons are properly functioning. Third is the children, they have not achieved the voluntary control, that is not under voluntary control, whereas the adult, they have already achieved their voluntary control. Next system comes is the gastrointestinal systems. Now what does the difference comes in the gastrointestinal systems? First is it's quite relaxed in infants, resulting in frequent regurgitations and vomiting. So we can say the gastrointestinal in children is very much relaxed, right? And which result in frequent regurgitations and vomiting. Whereas in adult, the cardiac sphincter of the stomach is fairly tight in the stomach. So we can say the cardiac sphincter that is being there in the stomach, it is being fairly tight. Okay, it's being fairly tight. So because of that, the adults don't face regurgitations and vomiting until any disease comes or any disease attacks them. So we can say in children, the gastrointestinal tract, that is, it is being quite relaxed in infants, which is resulting in the frequent regurgitations and vomiting. Whereas in adult, the cardiac sphincter of the stomach is being fairly tight in the stomach. Second point is GI functioning is immature and involuntary. The GI functioning is very, we can say, immature and involuntary. Whereas in adult, proper GI functioning and voluntary. Whereas we can say in adult, this GI functioning is it's being done properly as well as being functioning. Why? Because it is being already developed. Whereas in children, it is not yet developed. It is being developing. That is why it is being immature and involuntary. Third is temporary teeth. Children are having temporary teeth. After they achieve the 5 years or 6 years, the teeth are being replaced by the permanent teeth. Whereas in adult, they are having the permanent teeth. Fourth point in children is stool of neonate is loose. We can say the stool of neonate is very loose. Very loose, we cannot say, it's loose. Liver size is 45 of body weight. So we can say the liver size is 45 of their gram of their body weights. And whereas in adult, the stool of adult is hard and the liver size is 12 to 13 times its birth weight. So we can say liver size is doubled, that is, we can say 12 to 13 times, that's their birth weight, it is being bigger compared to the when the adult was a child. So we can say first is it's quite relaxed in infants, which is resulting in the frequent regurgitations and vomiting. Adult, we can say the cardiac sphincter of the stomach is fairly tight. Next is the GI functioning is immature and involuntary, whereas in adult they are having the proper GI functioning and voluntary. Third is they are having the temporary teeth. Children are having the temporary teeth, whereas the adults they are having the permanent teeth. Next is fourth is the stool of neonate is loose and the liver size is 45 grams of their body weight. Whereas in adults, the stool of adult is very hard and the liver size is 12 to 13 times its birth weight. Next come the endocrine system. So endocrine system, we can see this is the endocrine system pictures in which we can see the difference between children and adult. The endocrine glands which secrete the hormone are least developed at birth. So we can say the endocrine glands which basically secrete the hormones, they are least developed at birth. And hemostatic control is lacking till the age of 12 to 18 months. So we can say the hemostatic control is lacking till the age of 12 to 8 months. Whereas in adult, we can say the endocrine glands which secrete the hormones has been properly developed, and the hemostatic glands is being properly mature. So we can see the difference in the endocrine system also, in which the children's, they are having the endocrine systems which basically secretes the hormones, they are being least developed at birth, whereas the hemostatic control is lacking till the age of 12 months, whereas in adults this endocrine glands which basically secrete the hormones is being properly developed and the hemostatic control is being mature. Next come the reproductive system. So in reproductive system we can see the ovaries in the baby girl is approximately 10 mm in length and 2 to 4 mm in width. So we can see the ovaries, which is basically in the baby girl, is approximately only 10 millimeter in length and 2 to 4 millimeter in width, only 2 to 4 millimeter in width. Whereas in a boy, testes in a male baby are 1.5 to 2 centimeter long and 0.5 to 1 centimeter width. So we can say this much long is their testes, that is they are having 1.5 to 2 centimeter long and 0.5 to 1 centimeter in width. Functioning of ovaries started at the age of 12 to 13 years. In female, basically the function of ovary, it started at the age of 12 to 13 years. Whereas in boy, the size of testes increases gradually. The size of testes, it basically increases and reaches maturity between 13 to 17 years, and a boy achieve his maturity by the age of 13 to 17 years. So we can say these are the differences between a girl and a boy. We can say ovaries in a baby girl is approximately 10 mm in length and 2 to 4 mm in width. Whereas in boy, the testes in the male babies are 1.5 to 2 centimeter long and 0.5 to 1 centimeter in width. Whereas the functioning of the ovaries, they are started at the age of 12 to 13 years, and in boy the size of the testes, it gradually increases and they achieve maturity by 13 to 17 years. Next comes the musculoskeletal systems. So in musculoskeletal system we can just see the sutures in the skull of a newborn are not united. The first point is the sutures which are being present in the skull of the newborn, they are not united. Second is the infant bones are neither as firm nor as brittle as of adults. So fractures rarely occur in infant. If at all they occur, healing is very quick. So we can say first is the suture of a skull bone is not united. Second is the infant bones. The infant bones, they are neither they are firm and neither they are brittle, right? Like an adult. So basically fractures can occur in infant. They are very sensitive. Their head is very sensitive. So we can say they are neither firm nor brittle. So fractures can basically occur in the infants. And if at all they occur, healing is very quick. By chance, if fractures occurs in a newborn, the healing is too fast and the repairment is being done very fast. Next is in children, height increases as bones grows at epiphyses, whereas in adult height doesn't increase after certain age. We can say in children their height increases as they grow, right? Whereas in adult, after attaining certain maturity or after attaining certain age, their height doesn't increases. So we can say the suture in the skull newborn are not united. The infant bones, they are neither brittle nor firm as adults, and so fracture can easily occur. By chance, if fractures occurs, healing also took place very quickly. And in children, the height increases as bone grows at epiphyses, whereas in adult, it doesn't increases after certain age. So you can see in this picture also, this is the picture, we can say this is the head of the baby, of the newborn baby, in which you can see the fontanelles also. This is called as the fontanelles. You can see this is a fontanelles, and this is, we call it as the Sony plate, and this is, we call it as, this is a fontanelles. There are two fontanelles in the babies, that is, we call it as the anterior fontanelles and the posterior fontanelles. Anterior fontanelles is basically diamond shape, and posterior fontanelles we can see at the back, we can see at the back of the head. Okay, so these are the two fontanelles, and these fontanelles make sure that the parents, they should just take care of this fontanelles, because it properly all the sutures, it developed completely by 1.5 to 2 years. So that is why this region is to be kept very we can say safely, and also to protect the baby head also. Next system comes the neurologic systems. Okay, so next is neurologic systems. So in neurologic system, we can say the weight of the brain neonate is about 300 to 500 grams. Okay, so the newborn baby, the brain of the newborn baby is 300 to 500 grams, whereas the weight of the brain adult is 1300 to 1400 grams. So we can see how much difference is being there between a children and adult. Children's brain is only 300 to 500 gram, whereas adult brain consists of 1300 to 1400 grams. Second is reflex activity that are present during infancy. There are reflex activity which are present in the infancy, whereas in adult, it disappear in adult as a voluntary control is achieved. We can say it basically disappear as the voluntary control is achieved in an adult. Vision, eyes are not anatomically mature, not able to function. So we can say in vision, the eyes, they are not anatomically mature, and thus they are not able to function. Whereas in adult, eyes are mature and function properly. Whereas in adult, eyes, they are mature and they are functioning properly. Hearing ability, neonate can hear loud noise at birth. These neonates, they can hear loud noise at birth. That's why they get feared when the loud noise beer, and they used to just close their finger like this. So they can hear loud noise at birth, whereas adult, they can listen softer and soothing sound. Whereas adult, they prefer to hear the softer as well as the soothing sound. So we can say, summarize the neurologic system as the weight of the brain of the neonate is only 300 to 500 grams, whereas in adult is 1300 to 1400 grams. The reflex activities that are present during infancy, whereas in adult, it basically disappear in adult as voluntary control is achieved. Next is visions. Eyes are not so anatomically mature, so not able to function like that, and whereas in adults, they are mature and they function properly. Hearing, neonates, they can hear the loud noise at birth, whereas in adult, they can hear the softer and soothing sound. So we can say what we talked about the reflexes. So these are the various reflexes: tonic neck reflex, grasping reflex, stepping reflex, crawling reflex. These all are the reflexes. This is the, we can say, rooting reflex. So these are the reflexes that is present in the early infancies, and whereas in adult it disappear as they achieve their maturity. Lymphoid and immune system. Next is the lymphoid and immune system. So we can say in lymphoid and immune system, the maturation of lymphoid system varies with child's age. So we can say basically the maturations of this lymphoid, it varies according to the child's age. The lymphoid tissue is small but well developed at birth. So this lymphoid tissue is very small, but it developed at birth. It increases rapidly in size up to the age of 10 to 11 years. So we can say it basically increases in size up to the age of 10 to 11 years. So lymphoid and immune system, we can say the maturations of this lymphoid, it basically varies according to the age, and this lymphoid system is very small, tissue is very small, but it is being well developed at birth, and it basically increases in sizes, that is up to the age of 10 to 11 years. Next come the psychological changes. Now, what all are the psychological changes that basically appears? Newborn. In newborn, if we see, they are having fear, they are having escape, and they are avoiding strangers, right? Basically, whenever any stranger, they comes and say hello to a child, the infant usually cries. They give a reflex by crying. So we can say the newborn, they are having the fear, they are having the escape, and they avoid these strangers. That is the psychological impact what is being happening inside a child's brain. Next is in infancy, more bonding with the parents. Separation anxiety is very common. So we can say infancy stage is that stage that we can say 0 to 12 years, 0 to 1 years, where they develop a good bonding with their parents. And if a parents, they leave a child at home, they start crying. Why? Because separation anxiety develops in a infant. Next come the toddler stage, which basically starts from 1 to 3 years. Toddler is a stage that is from 1 to 3 years. That is negativity behaviors. That is, they try to act in a very negativity. They take everything in a negative way. How they take negative? If parents, they beat the child feels they don't love me. That is why they used to beat me. That is a negative side approach usually comes in a child. If we don't talk to a child feels that parents are always busy with their activities. They are not giving attention to it, and thus they develop a negativistic behavior. Then preschooler we used to say 3 to 6 years, in which they develop psychological differences like short attention span, easily distractible, right? Short attention span, we used to say the children, they are having only limited concentrations to concentrate at that particular time. They are having a short span. Easily distract. If any sound comes, they get distracted. If their friends come to meet them, they get distracted. If by chance they are studying, and in case any friend of them just call them, they just leave their study and they just go and meet their friends. So that is called as the distracting ability. That is called their psychological impact at that age. That we call it as preschooler time. Next come the schooler. Industry versus inferiority. That is, we can say they develop a feeling called industry versus inferiority. Inferiority, if certain parents they give attentions to one child and they are not giving attention to other child, there develops the inferiority complexes, right? And industry is that part, we can say, where they are being praised for certain activities, whatever they have done it. Next come the adolescent stage, in which identity of the fear and confusion. That is, during this adolescent time, they identify who are their friends, and if any role confusions, and certain they are also having the role confusions like what are their role to the society, what are they are going to play a certain roles in the society. That is, they are having certain confusions, and also at the meantime they identify their peer group also. So these all are the psychological differences happening according to the certain age group. That is, a newborn, infancy, toddler, preschooler, schooler, and adolescent. Next is the social and emotional development also, in which hospital, peers, school, and parents. We can say social and emotional development also happens in a child. If a child is being admitted in a hospital, and so he doesn't like that hospital environment. Why? Because everyone is a stranger there, and the prick of a needle, the injections, every invasive equipment that they are seeing, they get feared. They feel discomfort staying in the hospital. Next is the peers. They develops a good attachment with their friends, and they feel that they can be hangover with their friends or hanging out with their friends. They feel that their friends are everything. They can share each and everything with their friends. They feel some friends are there with them so that they can communicate with them. School is a place where they go and study. They have a good relationship developed between a teacher and a student, good relationship developed between a student and a student, and it is the best place for their emotional and the social development. Parents, we used to say parents, they are the first teacher, where the parents, they give certain lessons to the students, and thus they interact, thus they develop a good bonding between parents. So that is, we can say, social and emotional development. That is the hospital side, peer side, school, and parent side. Next comes the cognitive development. So in this picture also you can see it's a cognitive development stages. Sensory motor, that is 0 to 2 years. Pre-operational stage, that is 2 to 6 years. Concrete operational stage 6 to 12 years, and formal operation 12 years to adult. So in sensory motor stage, the infant explores the world through the direct sensory and motor contact, object permanence and separation anxiety develop during this stage. So we can say sensory motor stage, it is basically an infancy and the starting of the toddler stage, right? So in this, basically what does the infant observes? The infant, they basically observe the surrounding, the environments, the world. How? By their sensory, through their direct sensories and the motor contact. And they also develop certain, if they like some objects, like for example, if they like rattles, if somebody take that rattle, they feel very separated, they started to cry. So that we call it as object permanence and separation anxiety develops during this stages. That we call it as the sensory motor stage, that is 0 to 2 years. Next comes the pre-operational stage, that is 2 to 6 years, in which the child uses the symbols, words, images to represent objects but does not reason logically. So what is this stage? That is 2 to 6 years. That is the starting of the toddler stage and ending of the preschooler stage. So in this, the child, they develops the linguistic skill. They started talking, they started using the words, then they used to describe certain images, but they are not reasoning logically because they are a child. Their mind is being developing, they are not developed. The child also has the ability to pretend. During this stage, the child is egocentric, as well as during this stage only, they start mimicking it. They used to start pretending the fact, and at this stage also, the child is egocentric. He says no to certain things, he says yes to certain things. In this stage, the child becomes very egoistic. For example, if the child likes certain cartoons in the TV, and if the child doesn't get, or if he like that shows and we don't want to show, so they will be making excuses, or they making certain faces, or they will be saying they will not be having lunch or dinner if they are not able to see the cartoon. So that we call it as the egocentric. So that all develop in this pre-operational stage. Next come the concrete operational stage, that we call it as 6 to 12 years. The child can think logically about concrete object and can thus add and subtract. The child understand the conversation. So during this concrete operational stage, 6 to 12 years, that we call it a schooler stage. In this stage in which the child started thinking logically, right? In this the things in which the child add certain things and subtract certain things, and also the child understand what all are the conversations going on between a parents, between his friends. Everything is able to understand and correlate during this concrete operational stage. Next come the formal operational stage, that is 12 years to adult. The adolescent can reason abstractly and things in an hypothetical term. So we can say adolescent stage is that stage in which the adolescent can reason certain things, why they are being not allowed to do that things, and also they can things in an hypothetical terms. So these all are the cognitive development that is happening in certain age group, that is sensory motor, pre-operational, concrete operational, and formal operational. Next is the pathologic changes. So in pathologic changes, we can see there is imbalance of the fluid and electrolyte. We can see the child, they lose the fluid easily as compared to adult in condition like diarrhea, vomiting and burns, right? Because the child, they lose the fluid as compared to if certain disease occurs like diarrhea or vomiting, they used to vomit it like anything. So more and more number of fluid are being lost from their body. Child also get dehydrate easily. In this way, the child also get dehydrate easily. So that is imbalance of fluid and electrolyte. So in this, first we can say the child, they lose the fluid easily as compared to adults, like in certain diseases like diarrhea and vomiting or burns, and in a way the child can dehydrate easily. Second is resistance to diseases, in which we can say the baby get immunity from the mothers, which help the baby fight against infections for the first 3 months of life. So we can say the baby, they get an immunity from the mother. How they get the immunity from the mother? Because they get the breastfeed from the mother's milk. That is, if the mother is immune, he is giving the immunity to the baby also. So in this way, he can fight against the various infectious diseases for the first 3 months. Then signs and symptoms are different in children than adult. That we have already told. Certain signs and symptoms are different in children than in adult. So we can say in pathologic changes, first is the imbalance of fluid and electrolyte, second is resistance to diseases, and third is signs and symptoms are different in children than in adult. So these were the all differences between a children and an adult. Hope you have understood about this topic. So let's come to the conclusion part. As well as the more obvious physiological and cognitive differences between the children and adult, working with children and adult requires the considerations of future development, physical, social, emotional, cognitive as of primary importance. The need to be aware of the context in which a child and adolescent lives and function is crucial for both the provision of appropriate management as well as for the planning of future care. So we should know the difference between an adult and a child, then only we can treat them. We should know exactly how the child can perceive, how an adult can perceive. In this way, the treatment also becomes easy as well as there will be no difficulty from the part of the healthcare providers also. So hope you have understood about this topic, that is the difference between the adult and the child. Thank you so much for your cooperations and support.